Good morning, and thanks for tuning in. It's great to participate in health this year, even though we're virtual. I'm Christine Brocato, the System Vice President for Strategic Innovation at CommonSpirit Health.
And I'm Aaron Patzer, the co-founder and CEO at Vital.
In my role, I develop partnerships with innovative companies to address our organization's most pressing needs. Much of my focus is on scaling novel care delivery models that are affordable, equitable, and personalized to our patients. A little bit about CommonSpirit Health. We are the parent organization of Dignity Health and Catholic Health Initiatives, which came together in 2019, making us one of the largest not-for-profit systems in the country. We operate about 140 hospitals, 1,000 care sites across 21 states. And while we're large, we're unified by a bold mission, which is to serve the marginalized and vulnerable and address health disparities in the communities that we serve.
At Vital, we make AI-powered software for hospital patient experience. Prior to co-founding Vital with an emergency room doctor, Dr. Justin Schrager, I was the CEO and founder of Mint.com and then the head of product innovation across Intuit. While finance seems quite different from health, they're both very regulated fields. There are areas where there's a lot of anxiety and complexity and where you need a guide to simplify that for you. And that's what I hope that we've done at Vital, simplified the process for patients first, but also for doctors and nurses.
So let's talk about how this partnership got started and why this was important to CommonSpirit. First of all, emergency departments, sometimes called emergency rooms, are some of the most stressful areas in the hospital because by nature, there's so much uncertainty. People don't plan to go to the ED, they end up in the ED, oftentimes in pain and with so many questions. But the most common ones being, what's happening to me and when will I see a doctor? So the emergency department can be a really difficult place to exceed patient expectations because oftentimes their satisfaction is not only tied to the care that they receive, but their wait times and how informed they feel about their care. So a long visit without enough communication can lead to poor satisfaction despite the best efforts of our providers. So our leadership team wanted to understand what tools and processes could really move the needle on patient experience in the ED. And in doing our research, we came across Vital. And I remember watching their pitch about their product, ER Advisor, and all of a sudden I'm remembering all the many ED visits I've had in my younger years and how a tool like this could have been really helpful. And then I start looking around the room and I hear my colleagues saying the same thing. And that made me really curious because this experience is really universal, that you're going about your life and all of a sudden you have an unplanned illness or accident and you end up in the ED and you're nervous, you're stressed. And during a time like that where there's lots of uncertainty, having strong communication can make all the difference. So ultimately, our CommonSpirit team decided we wanted to work with Vital. We were really excited. We were just getting the work underway when the bottom fell out and COVID-19 essentially shut down the world. And we had no idea what was going to happen, but we knew we needed to plan for the worst. We were looking at what was happening in hospitals and EDs in New York and Seattle. And we didn't know how it would affect our EDs and our markets, but we were rapidly planning and mobilizing. In reality, what happened is that volumes went down in most of our markets, and understandably, people were scared to come into hospitals and EDs, and it was really important for us to let the community know that it was safe to come into the ED. We did not want people to hesitate if they were at home experiencing chest pains or broken bones or dizziness. So we focused on protocols that kept both our patients safe and staff safe. And some of those key strategies were to make sure patients were distanced when they came in, that we triage patients who could potentially be high risk for COVID, and then kept them informed about what to expect during their visit. but a lot of these processes were manual. So while many of our programs were paused or came to a halt because everyone needed to focus on COVID, our ED leadership felt really strongly that the Vital implementation needed to move forward because they could digitize some of these approaches and really support us in our COVID strategy. So with Vital, we were able to quickly deploy a touchless communication tool, and patients could register and then they could wait in their car or they could wait outside, and then ER advisor would let them know when it was time to be roomed. The tool also had a COVID-19 screener so that we could identify patients who might be high risk, automated communication for patients and their caregivers, and one-way messaging for our nurses to communicate with patients so that they can maintain high-touch care without additional risk. So while we didn't plan the implementation to go this way, the Vital solution was what we needed in our EDs during this very difficult time.
I remember that your team in Arizona helped us get this up and running in under 2 weeks' time. I think it was 10 or 11 days.
That's right.
We were out in the parking lot, giant posters printed, people holding up their phones with their COVID symptoms, red, green, yellow. It was amazing. I've never seen a health system work that fast and be that motivated. So let me dive into the product a bit, because what CommonSpirit and Dignity Health have delivered to their patients is exactly what we set out to build with Vital. So it's a software tool that's easy to implement and use, and it makes things easier for people during what is often one of the hardest days of their life. ER Advisor is consumer-grade software for the emergency department. It takes a lot of the fundamentals that drove success with Mint and applies them to healthcare, making things understandable, removing anxiety from the process. It's easy to use, it doesn't require any download, it's available in multiple languages. When a patient arrives in the emergency department, they're asked if they'd like to provide a cell phone number. That keeps them updated with their care path and their wait times. The number is used immediately. They get an invite through text message into a simple web experience that interfaces directly with the hospital's electronic medical records. Vital works with any EHR, and what's more is we've set up data partnerships so that we can connect to 3,000 out of the country's 5,000 hospitals, more or less with no IT required. On the patient side, once you're invited, the system uses artificial intelligence to keep you informed about what's coming up next and exactly how long it's expected to take. We're running about 10 AI models on everything from how backed up the CT scanner or X-ray machine is to the likelihood that the patient is going to be admitted. All of those things roll into what your wait time is, along with how many people have just showed up in the emergency department in the last hour. The system also provides patients with updates on their labs and imaging, their radiology, in real time. It gives you tips for a faster visit, which decreases your wait time, and directs patients towards convenient post-ED scheduling options. In the consumer world, we're accustomed to having shipping notifications tell us the status of a package. We're used to having Uber tell us exactly where our car is. And yet when you go into the hospital in an emergency situation, one of the most important times of your life and for your health, all that seems to vanish. And one of the big goals of Vital was to bring that back. So one of the patients said, it's like a Google Maps for the emergency department. It gives you those turn-by-turn directions, knowing what's coming next. During the peak of the pandemic, many health systems, and that includes CommonSpirit and Dignity, restricted access to visitors to their ERs and clinics just to keep people safe. To help ease that separation anxiety, Vital developed a way for patients to easily share their status with loved ones who couldn't be in the hospital with them.
What's interesting is that was the most popular feature for everyone inside of CommonSpirit. So it's been It's a small thing, but it's been a very, very popular feature within our walls.
Yeah, the average patient shares with, I think, 2.5 family members. They do so in a safe way. It doesn't show any personal health information, but it does show whether you've seen a doctor, not seen a doctor, whether you're waiting on labs, whether you're about to leave the emergency department, and maybe you need a ride home. So it doesn't surprise me how much that's ramped up. And it's increased like 20% in Delta as well, beyond where it was before.
Yeah, it makes sense.
Since launching, we've had about 50,000 patients share their status with over 100,000 loved ones and caregivers. At CommonSpirit alone, that's about 15,000 patients who have shared with 40 or 50,000 loved ones. Not only is that good for families, but it cuts down on the number of phone calls into the emergency department. Getting people out of the ED is often something that providers have difficulty with. If you know when family members are showing up, it helps improve the operations and flow as well.
Not surprisingly, patients have loved their ability to understand what will be happening to them during their emergency department visit, to be able to safely communicate with their care team, as well as to share the information with their loved ones. On average, over 50% of all patients who arrive with the cell phone during their emergency department visit are using this solution. And of those patients, 25% continue to use ER Advisor to access our patient portal and online scheduling resources. And we've been measuring the results throughout the pilot. We launched around April 15th, 2020, so right at the beginning of COVID. And 6 months later, we started to see some really positive trends emerge. For patients visiting our ED, the likelihood to recommend score on our HCAP survey moved from 30 to 98. And of course, we acknowledge that there's lots of things that go into this patient satisfaction increase, lots of people contributing to that. But the local team agrees that the Vital tool was a major contributor, which is a wonderful validation of our work together. And then even after a year into the program, we continue to see positive results on the HCAP survey. Our informed about delay score improved about 250% year over year. And this score tends to be highly correlated to the would recommend score, which also improved about 150%. And we were also able to move the needle on kept family and friends informed. One of the areas of focus for us has been around capturing patient needs in real time and using technology to connect patients to their caregivers. Recently, we had a story where an 84-year-old woman who was quite frail was talking to a clinician in one of our ED rooms. But once the clinician left the room, she realized that she forgot to ask for help to use the bathroom. And so she picked up her phone and she used ER Advisor to request help going to the bathroom, and a charge nurse was able to quickly receive that notice and go to her room and assist her in walking to the bathroom, which helped her not get lost in our very large ED, but also worst case, avoid a potential fall. So this sort of connectivity really changes how we conceive of patient experience in our hospitals and can potentially have a significant impact on patient outcomes.
Well, ER Advisor was easily incorporated into our ED patient registration workflow, and patients seem to navigate it easily on their own. I've received numerous compliments from ED patients regarding the increased level of communication provided by ER Advisor. They find it very helpful. ER Advisor must be working well because patients don't need any help using it.
If that's not the best quote of all, I don't know what is.
Agreed.
One aspect we often struggle with in the ED is making sure that when patients leave the ED, that they have the right follow-up care with other providers in our network to ensure continued treatment and healing. Our ED clinicians will recommend follow-up care, but we'll never know if that patient follows up with their care plan. So Vital was able to develop a solution where directly after ED discharge, ER Advisor leads patients to our search and schedule digital solution, or one of our staffed call centers. So by simplifying the process for patients and helping them make timely follow-up appointments, the market has realized a 5% increase in appointment volumes with an annualized net reimbursement value of about $1 million in the region. And this is attributed to both our established patients going to their physicians as well as new patients. So simply put, our analysis showed that for every dollar we invested into Vital, we received $2 back.
The product and the innovation have gone well enough that Dignity has asked us to do more, and they've been a great partner with no shortage of ideas. One of which that they came to us with was to improve the inpatient experience. So in August, after probably just about 3 months of development time, we can iterate quite quickly, we launched Care Advisor. So Care Advisor allows patients who are in the hospital, sometimes for days or weeks, to access useful hospital resources and for clinicians to send messages to patients from their mobile phones. That's particularly important for those patients who might be stuck in a COVID ward. One patient who was able to order his meal through Care Advisor likened it to DoorDash in the hospital. Another innovation that the Dignity CommonSpirit team proposed was to identify those patients who need follow-ups very quickly, sometimes in 24 or 48 hours. Those would be your cardiac patients or certain ortho or neurology events. And we were able to write algorithms which identify those patients in real time based on AI from their notes and send a notification to a care coordinator. That care coordinator can talk to the patient before they leave the emergency department, schedule the appointment, and it's a real concierge-like experience.
And Aaron, that quick responsiveness that you describe is one of the reasons why we really value this partnership with Vital. It's been really exciting to grow this national partnership and to share for the first time publicly the amazing results we've realized within this partnership to date. We started with the pilot at Dignity Health Arizona, and now we're actively scaling the program in California and Iowa, with further expansion plans in 2022 and beyond. In my opinion, this has been a no-brainer for us. We have a compelling ROI. Our staff are freed up because they have less questions to field at the front desk and other areas of the ED. And most importantly, our patients and their families really value having frequent and relevant communications. We look forward to growing this solution into additional markets so that more of our patients can have this experience in our emergency departments.
To learn more about CommonSpirit and Vital software, visit vitaler.com. And thanks for being a good partner and for doing this with me. And thank you for having us at Health.
Thank you.